folks. I have read your part 1 of your quality project and have provided feedback in your rubrics for your work from last week. I have to tell you that I was very impressed with your ideas. We have, in your class, we have 3 people covering falls. We have 1 person covering hospital-acquired infections, someone reviewing the overcrowding in an emergency room, and then someone looking at the impact of nurses not having adequate breaks during their workday and how that impacts quality. So lots of broad ideas that I think are going to have a lot of really good results. So I'm looking forward to seeing how you take the insights that you've learned about how your hospital is currently managing your quality issue and applying it to part 2 of your assignment. So I do want to remind you to start thinking about what you're going to do as far as your second part of this activity. It would behoove you to start thinking about that now so that you can plan accordingly, because your part 2 is not a paper, it's actually a video. So you have to do a little bit of footwork for that and get that presented. So if you have some trouble with technology or you struggle with doing something that isn't a formal paper, go ahead and start processing that and make sure that you're accessing appropriate resources to learn the skills that you may need to be successful in that assignment. One of your classmates did such a good job of kind of putting a framework around quality issues and what's driving that quality issue. Your classmate Suzanne wrote in regard to her issue that one such potential reality can be described as a zero patient harm, where the goal is preventing all hospital-acquired infections. In response to the 2005 Deficit Reduction Act, the Centers for Medicare and Medicaid Services adopted a policy in 2008 whereby hospitals will no longer be reimbursed for hospital-acquired infections. Therefore, the new regulations predict that the potential reality will become the actual reality. Nurse leaders must be able to interpret how this potential reality will impact their healthcare environment and coach their teams through the transition from a potential reality to an actual reality. So if you think about your quality issue, we've always been kind of chasing the dime behind our quality issues. We've always talked about what ideal would look like and had great charts and graphs and policy papers within our organizations to discuss quality issues. And that's the potential of what good quality care should look like. We are now, through the Affordable Care Act and the Deficit Reduction Act and CMS regulation, having to put our money where our mouth is. So our policy papers and our platitudes about how much we value quality and how much we want quality care for our patients is now having a huge fiscal impact on hospital organizations. And those that are failing to provide quality care are going to face significant financial consequences for failing to do so. So I really appreciate Suzanne kind of giving that framework of where we were and where we need to be, and understanding that so much of that is not, unfortunately, being driven through altruistic ideas or plans. We're being forced because of our own failure as a healthcare organization. We didn't do what we said we were going to do. We continue to have patient falls and hospital-acquired infections, and we still don't wash our hands. So now we're going to have financial consequences for doing that. So I appreciate the framework that Suzanne gave to that insight. As far as an APA general issues, there are 2 areas I want to just mention. First is I want to remind you to think through using APA level headings. This paper, for the most part, most of you wrote between 7 and 10 pages. Because of the length and the complexity and the variability in topics, you should have been using level 1 and level 2 at a minimum. Some of your work would have lent itself to level 3. I want you to spend a little bit of time looking in your APA manual or Googling, when do you use level 1, 2, 3? Your final paper may need 4. As a professional writer, and that's what we aspire to be in graduate work, you need to be able to organize your writing in sections to guide your reader, and that's what the level headings do for your reader and for your own writing skill. The last thing I'll talk to you about is the importance of writing when you select references, that you are selecting peer-reviewed, research-based references. Several of you are using editorials or commentary that are published by single authors and citing it as adequate evidence. Don't get me wrong, there are some fantastic editorials and commentary written by specialty area experts, and their opinion absolutely matters. But when it is their opinion, you need to be careful citing it as evidence or proof of your own insight or thought. The difference in that is when there is a Delphi study, and I don't mean to make you cry or be fearful, but I'm going to talk research for just a moment. A Delphi study is when a collection, normally about 12, experts in a single field get together and they collectively share their pearls of wisdom or their insights or their expertise. A Delphi study, for all intents and purposes, is a lot of opinions, but they're informed opinions from experts, and it's published as a Delphi study. I have not seen that used frequently because they're really tough research designs to do. If you are using a commentary or an editorial within your work because you really like what they've said and you think it makes sense, that's great. But you need to do a combined reference. It's okay to use an editorial, but you need to find a better source to supplement that as evidence. So you would actually do your reference you would reference two sources to support your ideas. So I want you to be careful as you're reading your articles and you're looking for research. Be careful using an editorial or a commentary unless you're going to supplement it with a secondary resource to bolster your opinion. Now, let me give you another example. If you find 2 or 3 authors who have done editorials and they're saying the same thing, put those 2 or 3 authors, combined editorials, you're kind of building your own Delphi study, and that to me is reasonable. But avoid using them as standalone references. They aren't scholarly, they're not peer-reviewed, they're just somebody's opinion. Even if it's fabulously worded, it isn't adequate for graduate work. Okay, let's talk about next week. Next week, the only things I want to remind you is your assignment has 2 parts. One is a Word document and one is a PowerPoint. Your Blackboard will accept 2 files. So put in your Word and your PowerPoint documents before you hit submit. Let me say that again. Your Word and PowerPoint documents need to be attached in Blackboard before you hit submit. When I open it, I'll grade them individually, but they're both on the same rubric. If they are both not there, I cannot grade what is not present. And please don't send it to me as an email. I've been asked several times kind of thoughts about what a PowerPoint should look like, how long should it be, what details should be in there. You're going to have to determine your own approach to how you're going to encourage innovation within an organization. The idea is to be persuasive and to get people's attention. My best guide is about 10 slides. If you need 8, that's okay. If you need a dozen or 15, that's okay too. It is not, if you think about normally, if you're going to do just a brief in-service, we want to say 10 or 15 minutes. We guide about 1 minute per slide. So that means about 10 minutes, 10 slides. And that's all I want. The bigger issue is not how many, but how creative can you be? How attentive are you going to get your audience to be by your use of this type of technology? So know that when I'm looking at it, I'm going to be asking myself, if they were showing this to a room of 30 people, are people going to be checking their cell phones for messages and talking to one another? Or is this PowerPoint interesting enough and aesthetic enough that I'm going to want to see what's on the next slide? Folks, it matters. As professional leaders, you're going to be standing in front of people, showing your own work or showing a PowerPoint. And if your design of your PowerPoint, no matter what the content is, if the design is poor and it's not aesthetic and it doesn't maintain interest, your content won't be delivered appropriately. So balance those two with length and aesthetics to get your point across. The topic is a pretty easy topic. Okay. I think I have talked enough. I hope you all are well. Thank you so much for the well wishes for my daughter's wedding. She was a stunning bride. I did not, it was an outdoor wedding, and I did not pray once for it not to rain. I prayed for her peace and her joy in the experience. So clearly God knew that I was okay with rain, and it poured all day Sunday. So we were perfectly okay with an inside wedding, and it was absolutely wonderful. So I'm so grateful for the blessings and the prayers that have been sent our way. I hope you guys have a great week. Know that I'm here. Send me an email and touch base if you have questions or concerns. Y'all take care.